A pleasant day to all our fellow participants in the 6th International Conference of the International Organization for Health, Sports, and Kinesiology. We are delighted to share with you our research entitled The Effect of Sports Engagement on Selected Behavior of Grassroots Age Female Rhythmic Gymnasts during the COVID-19 pandemic. The members of our research group are Jazelle Luis Limenzon, Sydney C., and Michael David Tan Lopez, RPM, MS, HMS. We are all from the University of Santo Tomas Institute of Physical Education and Athletics in Manila, the Philippines. Bronfenbrenner and Morris said that the home environment as an ecological context is essential for children's physical, emotional, behavioral, and cognitive development. Children need emotional support, values, and character development to develop positive behavior. This can be further developed by engaging in activities that allow for responsive interaction. However, due to the COVID-19 pandemic, children were not allowed to go to playgrounds, which impeded early motor skills development and also led to feelings of isolation. Some have even developed unpleasant behaviors, aggressive tendencies, temper tantrums, and anxiety, Soon et al. 2022. Virtual learning has replaced traditional teaching in schools. This made gadget screen time longer than physical activity, communication, and recreation. It also affected children's sleep, which led to mood changes, shouting, swearing, harsh language, bullying, and tantrums. Jalalinia et al. 2020. Sports participation improves holistic well-being. It improves children's physical health and social intelligence through field contacts. Bronfenbrenner and Morris, 2006. It also improves life skills, and its ethical values promote positive attitudes. Thus, it improves children's morality and behavior early on, Yaffe et al. 2021. For this study, we will be using the behavioral theories of Pavlov's classical conditioning, Skinner's operant conditioning, and Bandura's social learning theory. Classical conditioning entails learning by matching a naturally occurring condition with a previously neutral stimulus. According to behaviorism, all learning occurs through interactions with the environment, and the environment profoundly shapes behavior. Meanwhile, operant conditioning uses reinforcement and punishment to modify behavior. It is a learning technique that involves the effect of punishment and praise on the modification of behavior and the association between a behavior and a negative or positive consequence. On the other hand, social learning theory is where children acquire new skills and knowledge by observing the actions of others, including their parents and friends. These theories helped establish the results of our study, which focused on the impact of sports participation on children's behavior, specifically acting out, fearful, and anxious withdrawal. The researchers used a descriptive correlational methodology to describe the association between the variables. The study employed this design to see if participants' demographics, such as age and length of training in rhythmic gymnastics, are correlated with the acting out, anxious withdrawal, and fearful behaviors. The sampling method that was used to gather the 96 female respondents was a purposive sampling technique. The age of the respondents ranged from 8 to 12 years old. The administration of the research instrument was done online through Google Forms, since the existing policies during the time of data gathering was still limited to face-to-face interactions for children under these ages. The researchers used Saylor, Swenson, Reynolds, and Taylor's 1999 Pediatric Emotional Distress Scale, or the PEDS, as a standard questionnaire to measure out acting out behavior, anxious withdrawal behavior, and fearful behavior. It consists of 21 questions, which are all scored on a 4-item Likert rating scale, rated from 1 being almost never, 2 being sometimes, 3 being often, and 4 being very often.
Table 2 shows the demographic profile of the respondents based on age and length of engagement in rhythmic gymnastics. The respondents' age ranged from 8 to 12, a total of 26 responses, or 27.8% of the total number, were from the respondents who were 12 years old. Respondents who were 8 years old had a total of 24 responses, or 25% of the total number, followed by respondents who were 10 years of age, with a total of 20 of the total number, or 20.83%. 9 and 11 years old respondents comprise less than 15% for this demographic category. Respondents with 1 to 6 months of engagement have the highest number of responses, with a total of 32 responses that comprise 33.33% of the total number of responses. This followed by respondents with more than 3 years of engagement, who have 27 total responses, which is 28.13% of the total number. Respondents with 1 to 3 years of engagement were 20, which covers 20.83% of the total responses. On the other hand, respondents with 10 months to 1 year and 7 to 9 months each covered less than 10% of the total number of responses. Table 3 shows the participants' behavior profiles in terms of anxious withdrawal behaviors with an overall mean of 1.52, which is interpreted as almost never. This means that the extent of influence is slowly observed at 0 to 25%. Hence, this also means that most of the respondents have low or no manifestation of anxious withdrawal behaviors. There are some items that reported higher means, such as those about worry, aches, and pain. Pain causes emotional changes in both people and animals, such as fear and anxiety. Fear and worry, on the other hand, may exacerbate the suffering of individuals. Pain pathways are frequently studied using behavioral withdrawal reactions to painful stimuli. Zhu et al. 2019. Table 4 shows the behavior profiles of the participants in terms of fearful behaviors, with an overall mean of 1.60 and interpreted as almost never. This means that the extent of influence is slowly observed at 0 to 25%. As a result, most respondents have little or no demonstration of fearful behaviors. One item refuses to sleep alone has a mean score of 1.81, which means that the extent of influence of this item is moderately observed at 26 to 50%. According to Blasis, John Kerai, Lefter, Yu, Ann, and Nedelec in 2021, athletes and gymnasts are especially vulnerable to sleeping disorders. A better understanding of the social physiological stressors influencing athletes' special sleeping pattern, like early morning training sessions and media use, could have a direct impact on recovery and preparation for future training and competition. Table 5 shows the behavior profile of the participants in terms of acting out behaviors. With an overall mean of 1.77 and interpreted as sometimes, this means that the extent of influence is moderately observed at 26 to 50%. Items such as seems hyperactive, want things right away, and gets frustrated too easily have the highest mean score among all other items. This means that these behaviors are relatively evident in the respondents. However, these are not significantly evident in most cases, since the mean scores are considered low after all. These behaviors have been shown in studies to also cause anxiety and depression. Female athletes in general experience high level of anxiety and depression. It was discovered that reported rates of depression in athletes range from 15.6% to 21%. They identified risk factors specific to athletes such as performance expectations, overtraining, sports-related injury, and involuntary career termination. Herrero, Jejurikar, and Carter 2020. Table 6 shows the relationship between the age and the different behavioral profiles of the participant. The coefficient for the statistical treatment was pegged at a 5% level of significance. For the relationship between age and anxious withdrawal behaviors, the table shows the value which is equal to 0.14. This means that there is a positive negligible correlation between age and the acting out behaviors. The table also revealed that the computed p-value is 1.34 and a tabular value of 1.99. Since the computed t-value is less than the tabular t-value, the null hypothesis will be accepted. Therefore, there's no significant relationship between the age and anxious withdrawal behaviors of the participants. The table also presented the relationship between age and fearful behaviors, the value of which is equal to negative 0.7. This means that there is a negative negligible correlation between age and the fearful behaviors of the participants. The table also shows that the computed t-value is 0.65 and a tabular value equal to 1.99. Since the computed t-value is less than the tabular t-value, the null hypothesis will be accepted. Therefore, there is no significant relationship between the age and fearful behaviors of the participants. For the relationship between age and acting out behaviors, the table shows the value which is 0.10. This means that there is a positive negligible correlation between age and the acting out behaviors of the participants. The table also revealed that the computed t-value is 0.95 and a tabular value of 1.99. Since the computed t-value is less than the tabular t-value, the null hypothesis will be accepted. Therefore, there is no significant relationship between the age and acting out behaviors of the participants. The relationship between the length of engagement and the various behavioral profiles of the participants is shown in Table 7. The Pearson correlation coefficient was the statistical tool used with a level of significance of 5%. For the correlation between anxious withdrawal behaviors and the length of engagement, the Pearson correlation coefficient value is equal to negative 0.2, indicating a weak negative correlation between the length of engagement and the acting out behaviors of the participants. The table also showed the computed t-value to be 0.24 and the tabular value to be 1.99. The null hypothesis will be accepted because the computed t-value is lower than the tabular t-value. As a result, there is no correlation between the frequency of engagement and anxious withdrawal behaviors. The table also presents the relationship between the length of engagement and fearful behaviors. Using the Pearson correlation coefficient, the table shows the value which is negative 0.5. This means that there is a negative negligible correlation between the length of engagement and the fearful behaviors of the participant. The table also revealed that the computed t-value is equal to 0.48 and the tabular value equal to 1.99. Since the computed t-value is less than the tabular t-value, the null hypothesis will be accepted. Therefore, there is no significant relationship between the length of engagement and fearful behaviors of the participants. For the relationship between the length of engagement and acting out behaviors, the table shows the Pearson correlation coefficient value of 0.02. This means that there is a positive negligible correlation between the length of engagement and the acting out behaviors of the participants. The table also revealed that the computed t-value is equal to 0.17 and a tabular value equal to 1.99. Since the computed t-value is less than the tabular t-value, the null hypothesis will be accepted. Therefore, there is no significant relationship between the length of engagement and acting out behavior of the participants. With the results presented, the researchers conclude that there is no significant correlation between any behavioral profile of the participants' age and length of engagement in sports The researchers recommend the following. Parents must consider engaging their children in sports at a young age to develop social skills that could foster positive behaviors. Rhythmic gymnastics program, all sports program, must consider having training not just to improve sports performance or sports-specific skills at an early age, but also to have interactive practice with teammates to instill discipline, camaraderie, trust, and courage. Schools are encouraged to create a developmental program for sports and allow children to participate to develop new skills, develop or have interactive exposure, which can greatly benefit the children's development. Future researchers should further examine the effects of sports engagement on the behavior of selected grassroots age female rhythmic gymnasts. They could investigate the effects of sports engagement on different behavioral factors such as motivation, commitment, athletic identity, and goal adherence. Other demographic variable, statistical tools, and instruments can also be used. That would be all for our presentation. Thank you very much for your time. Have a wonderful IOHSK conference.